When we say the word decay, it means that there is disease in a tooth. Tooth decay is a diseased tooth. Dentin is the other D word. Right under the outer layer of your tooth is dentin. Dentin is the second layer of your tooth. And then we have the word distal. Now, the midline of your mouth is right between the upper and lower front teeth. So anything moving towards the midline has a name, but anything moving away from the midline is referred to as distal. So the distal aspect of the tooth is the aspect of the tooth that is away from the midline. Distal, moving towards the back, away from the midline. Then we have the word ectomy. Ectomy is usually added to a word to let you know that we're talking about removal. So gingivectomy means you're removing the gum. Pulpectomy means that we're removing the pulp. Ectomy means removal. And let's talk about the hardest structure in your mouth. And that is the outer layer of your teeth. Enamel. Enamel is the outer lining, the protective layer of your teeth, and it is the hardest structure in your body. It's harder than bone. Then we talk about extraction. The removal of a tooth is known as an extraction. Then we move on to the F's. Fissure. What is a fissure? Fissure is a groove. You know, if you should examine your teeth carefully, you'll notice that there are little creases or grooves in your teeth. And we refer to those grooves as fissures. All right, fluoride. Fluoride is so important because before fluoride, people used to get far more cavities than they have now. So fluoride is an agent that sometimes it's in toothpaste, or if you're in the dental office, fluoride stands on its own, but it is used to protect the teeth, to strengthen that enamel, to prevent tooth decay. In some places, they have fluoride in the water. Some places, they have fluoride in the salt. But most places will find fluoride in the toothpaste. Sometimes you have a mouth rinse that has fluoride. And it is to protect the enamel from tooth decay. Gingiva is a fancy name for your gums. So if you want to show off on your friend and you said, I think I have this thing here on my gingiva. You're going to say, what? Gingiva. Your gum is what you refer to when you're speaking to patients and people who are not in the field of dentistry. But when you're referring to your colleagues and your dentist, you use the word gingiva.